Hi there. Welcome to the Health Analytic Insights Podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at HealthAnalyticInsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly. On this episode of the Health Analytic Insights Podcast, I'm honored to interview Daniel Yeboah, who is the founder and general manager of Ellerca Health Corp, whose mission is to improve patient care through leading technologies and innovation. Daniel has over 10 years of experience as a healthcare provider in oncology and rare disease nursing, and I'm so excited to hear his thoughts on today's episode of the podcast. But before we dive into it, Daniel, can you tell the audience a bit about your background and what got you interested in digital health?
Sure. Thank you, Elena, and thank you for having me here on the podcast today. So my background is in nursing. Been a nurse for just about 11 years now. And so when I started off in nursing, ironically, I started off in oncology. Worked in oncology, did some stuff at work in clinical research, and then eventually I moved into patient support programs. In managing patient support programs, there I also managed these really large oncology programs, and then from there progressed into some other roles where I was eventually moved into rare diseases, and then moved into ultra rare disease management. And throughout that experience, I've had an opportunity to look at how healthcare was delivered. And really see healthcare on every side. So I know how it's delivered as a provider, how the healthcare is provided to patients. I understand the payer perspective, and so it's giving me a very good overview, 360 view of healthcare and all the delivery models. And then throughout that experience, I had a family member that was struggling with diabetes. And throughout that experience, we really saw that family member progress. So they were living with type 2. Eventually, that family member eventually did get an amputation. And then once that amputation took place, then you saw the progression where depression set in, and they eventually, so you saw them give up, right? And as they began to give up, you saw things in their overall health become to deteriorate. And I think for me, that amputation probably was the turning point where I questioned that, as a nurse, I was looking at my family member from the lens of a family member and not from the lens of a clinical perspective. And then realizing, there's things that I should have and could have done to assist or help with some interventions along the way. And then eventually, the family member passed away. And through that experience, for me, it was really, what are some of the things that could have been done? And so realizing that if we as a family had to deal with that issue, there's probably a lot more other families right across Canada, right across North America, right across around the world that are dealing with very, very similar issues, right? And so through that, that's when Ellerca Health was born.
Oh, very, very interesting. And that's a kind of thread that I've seen interviewing people, especially in healthcare. They have a personal connection,
Right.
and then it causes them to create something to make the world better. So it's amazing that you're able to create Ellerca from this situation. So that's really awesome. And you've talked about your work as a clinician, and I'm wondering, what are some of the biggest gaps that you've noticed across your career in healthcare, and how do you see technology really impacting this and making a difference?
I think when it comes to what are some of the biggest gaps, I think there's the cliche that healthcare is broken, right? And so I'd come back to the healthcare system is not broken. It's the delivery model that is broken, and so we have to focus on actually providing care to individuals and not servicing what I call these episodic issues, right? And so when we look at healthcare, the word is caring for someone's health. And when you look at the existing healthcare model, what we look at is, I hurt myself, I need this to be fixed. I've done X and this is what needs to be done, right? And so even our interactions that we have with our physicians are episodic in nature and not continuous. And so recognizing that that's where the gap was is taking the experience that I had from a clinical perspective and recognizing that continuous care models is the actual route that we should be going,
Mm-hmm.
where we form a relationship with an individual over a period of time. And that relationship over a period of time also acts as a preventative method, right?
Mm-hmm.
When you look at chronic diseases, a lot of the issues around chronic disease management is really the foundations of it are based on lifestyle and behavior. And so when we have the right inputs, the right resources, the right supports in place to help us make the better better lifestyle decisions based on behavior, we actually achieve better healthy outcomes, right? And so
Mm-hmm.
as we begin to focus on healthy outcomes, not fixing an issue that happened today, right? Not, I have a cough, so I need to go see the doctor, but what are some of the things that I'm doing in my life that brought on that cough, right?
Mm-hmm.
Not now, recognizing that people will get sick. And so we're not going to live in a world where we're absent of illness, but there's definitely things that we can and should be doing that we are not doing that contribute to us having unhealthy outcomes. And so, for me, it was what can be done differently. How do you deliver care differently to actually provide positive, healthy outcomes to the individuals that we serve?
Yeah, and that really resonates with me. One of the great things about traveling is you get to see different perspectives. And I remember traveling to China and seeing kind of how old people or older people or aging people are kind of their lifestyle. Because I remember visiting this park and it was just filled with these people. I think they must be over 70, just in the park,
Right.
exercising on the gym equipment. And I'm wondering how much of that do you think is cultural? Because I think about the aging homes here in Canada, and it's a very different cultural effect where you see people kind of more confined to their beds in more isolated environments. They're not really socializing a lot with other people. I'm wondering how much you think that comes in the culture of Western society.
Oh, for sure. I mean, when you look at again culture, I think culture definitely plays a huge part in healthy outcomes. When you look at blue zones, right? Blue zones are where the most healthiest individuals live in the world, where people have the longest lives, right? The longevity in those blue zones are outpace what the normal society has. And so I think there's definite opportunities for us to look at what some of those areas are doing that contribute to positive healthy outcomes. I also believe that culture should also be considered. One of the things that we look at in the space of diabetes is working with First Nations. And so it's really really easy for someone that provides diabetes care to barrel into a First Nations community and tell them you shouldn't eat this, you shouldn't do this, you need to exercise 30 minutes a day. But it's like, hold on a second. You need to understand that culture,
Mm-hmm.
right? And when you begin to understand that culture, is that they also have their method of healing, their certain beliefs around health, right? And
Absolutely.
so it's really important to marry the two cultures together, where number one, you're listening to them to understand their culture, and then what could we take in our Western medicine
Mm-hmm.
to weave into their culture to contribute to better healthy outcomes. And so one of the things that we do, with our offering is we listen to the patient first. And so before we begin telling somebody this is what you should do, don't do this, and turning their life upside down,
Mm-hmm.
it's hold on a second. Let me hear your story, right? Let me understand what your challenges are, right? Some of the feedback that I hear all the time is I talk to a dietitian and the only thing I hear is what I can and cannot eat, right? And that should not be your relationship with your dietitian. It should really be around what are the challenges that I'm facing as an individual, and how could my dietitian help me overcome those challenges to achieve healthy outcomes.
Yeah, that makes a lot of sense. And I think that's very powerful. If you start from a place of conversation with individuals and then move to, the point that you're going to make, but having that understanding first of what the patient is going through, their story, I think that's the only way you can make any impactful change. And I think my hope would be that we move to more of a preventative type of medicine than more of a prescriptive, as you're saying. Like, I
Right.
think that if we can integrate things from the very start, potentially the outcomes won't be as dire. So,
Right. Yeah, absolutely.
so my next question is, what do you think about the growing trend of patient-generated health data? So we have things like Fitbits, glucose monitors, a lot of health tech to kind of manage diseases such as diabetes. And as health tech continues to grow, do you see any push to integrate this data into common healthcare systems?
Absolutely. When you look at patient-generated health data, I think that's really, really important. Number one, individuals are now becoming more and more interested in management of their care. And once an individual takes interest in their care, they will automatically, again, achieve healthier outcomes, right? Because they're playing an active role in their care, whereas 5 years ago, 10 years ago, it was a very passive role where you went to the doctor's office, the doctor told you
Hmm.
what to do and what not to do when you walked out of the office. Now, as an individual, when I have my Fitbit, well, guess what? I'm always interested in how many steps did I do today. I'm making sure I'm logging how much water I'm doing. I'm looking at my sleep score, right? And so I'm more and more interested in health. And so as we start to see more and more health data being ingested on the healthcare side, we're actually we're better able to provide better contextualized feedback and care to that individual. I'll give you an example. If you have a plan with an individual, one of the things that happened before is an individual would go to their doctor. Doctor says, you know what, you need to lose weight, and you need to exercise 3 times a week, and you need to walk for 30 minutes a day minimum. And
Hmm.
so you would say okay with your doctor, and you'd leave the doctor's office. The probability of you actually doing it is about 5%, if not less, right? Because there's no motivation around it. And now when you look at devices like the Fitbit or the Apple Health or the Google Fit, right? What happens when you have these smartwatches on your wrist?
Hmm.
Every hour you get a little jolt that says get up and stretch.
Hmm.
There's health nudges that now take place, right? And so once you have that, it's now encouraging you to move.
Hmm.
And so when you look at these smart devices, another example is you start walking. And what happens when you reach 10,000 steps or 5,000 steps? That's whatever step count that you've set as a goal for yourself.
Hmm.
Your phone starts to buzz, your watch starts to have these big balloons, these celebrations. And what does that do? It says, great job, fantastic, you've done it, right? And
Hmm.
as an individual, that motivates you to do even more. And
Hmm.
so now you're confident and realize, wow, I can walk 5,000 steps a day.
Hmm.
But now you're going to try to do 6,000. And then you're going to do 7,000. And so you're making that effort to get healthier and healthier and healthier. And then from the provider side, again, where that comes into play is when you're working with your provider, and your provider sets a plan with you and says, hey, Ilana, I need you to walk 30 minutes a day. Well, guess what? If they're doing some remote monitoring where your device is connected to your mobile app, and then that data is now going through back to a data center, when you meet with your provider a month from now, 2 months from now, 3 months from now, guess what your provider says? Alana, you've been doing a great job over the last 2 months, right?
Exactly.
And
Hmm.
now that relationship with your provider is completely different,
Hmm.
because it's not a relationship where you're being told, Alana, you haven't been walking enough. Alana, you're putting on weight. And it's like,
Hmm.
hold on a second. You don't understand what some of my challenges have been in the last month, right? because your doctor really doesn't care, right? But now if your health coach, if your healthcare provider is able to understand, hey, you know what, Alana, let's talk. I saw you had a really, really great week 2 weeks ago. Last week, you went down. What happened?
Right.
Right?
Mm-hmm.
And now you can provide some context with, I was studying for exams. I just wasn't able to.
Mm-hmm.
It was last week, it was raining the whole week,
Mm-hmm.
right? Or it was moving, or I broke my leg, right? And
Mm-hmm.
now you're able to provide context. And this is what having these smart devices and all these health and these additional inputs provide more context to the individual or the organization that's looking after that person as a whole.
Yeah, very, very good points. And I think that there's something to kind of gamifying the whole health tech process. My aunt, it doesn't matter if it's 10 p.m., 11 p.m., she will walk around the whole neighborhood until she gets those 10,000 steps
There you
before
go.
it's the next day, right? So
There you go.
gamifying the whole process of managing your health, and also that collaboration aspect that you're talking about, where you can take note of your data and then have that conversation with the clinician. It's no longer just you do this, a
Right.
one way communication. It's really you're having a stake in the game because
Absolutely.
you're now integrating it. And also, I think you talked previously about stories. It would be amazing to be able to integrate that into the EHR and really have an individualized, personalized story of the individual, because we're all different. We all have different cultural backgrounds, all these things that affect our health. So
Right.
having that text data into the EHR would be absolutely wonderful if that's something that we can eventually move towards in the future.
Yes. Absolutely. Absolutely. I think we're heading in that direction, right?
Mhm.
The challenge is when you're looking at EHRs, they're complex systems.
Right.
They're all built differently, and so there are challenges in connecting with them. And then some of those challenges are just regulatory challenges. But I think we're as we look to the future of the next 5 years, what will we see? Yeah, I do believe that we will reach a place where there is full integration.
Mhm. And that brings me to another question. Where do you hope to see the future of health tech, in the next 10 years? And kind of where do you see your place in the whole health tech movement?
For me, I see health tech, health as becoming really the banner of what we do. And I look at health as health is a fully integrated in what we do. And so
Mhm.
the same way we do online banking, we do mobile banking, we do all our interactions over the phone with our mobile device. It's a mobile first experience. I believe that that's where we're going with health, where health is going to become a mobile first experience. And we're no longer going to refer to it as telehealth. It's just going to be called health. It's right. It's going to be called healthcare. We're not going to do what we call video conferencing. It's going to be, I'm having a call with my care provider, right? And so we're going to start removing those elements, right? Long time ago, when they introduced telephone banking, they called it telebanking, right?
Oh,
And then they introduced online banking. It was online banking. However, you rarely hear online banking. You just do
yeah,
your
it's just
banking online,
yeah,
right?
yeah.
And
Just
so
using.
when we look at healthcare, we're going to see healthcare delivered at your grocery store, at your pharmacy,
Mhm.
at the bank. It's going to be an integrated experience. And
Yeah.
so wherever you're going, whatever you're doing, your healthcare is all part and parcel of what you do. And so data will be shared back and forth with the entities that require access to your data and to specific parts of data. Again, that will help that individual achieve healthy outcomes. Good
Mhm.
example is you're going to your doctor's office. And what we're doing now is we go to our doctor's office, the doctor takes your blood pressure. Some
Mhm.
people have white coat syndrome. And so every time you go to your doctor's office, your blood pressure is always high. And so
Mhm.
your doctor will now change the medication, increase the dosing, and say, well, you know what? Your blood pressure is really, really high. I'm going to change your blood pressure. And now when we're moving towards a more digital experience where I have the blood pressure monitor at home,
Mhm.
I take my reading. The reading goes from the device straight into my cell phone. and it goes into a data center. And now when you have that virtual consult or that consult with your physician,
Mm-hmm.
prior to, in the middle of the conversation, they will see your data, and they will see your data as it's been trending over a period of time, and recognizing that I don't need to modify this individual's medication because I can look at the trend line over the last month, I could over the last 6 months, over the last year, and realize, no, I don't need to do this. And then we're going to look at how do we start to look at cost management in healthcare, right? How do you look at medication adherence, right? And so there's a huge problem with medication adherence, as in, here I am, I've gotten medication, and I've left my doctor's office. The doctor tells me to fill my prescription. Do you realize that 50% of individuals that leave their physician's office do not fill that prescription?
Oh, wow. Did not know
And
that.
yeah, and then 50% of those individuals that actually do fill the prescription,
Mm-hmm.
then there's a huge proportion of them that actually don't take the medication, or they don't take the medication that's prescribed, right? And so again, now we're moving into smart adherence solutions, whereby now your phone will send you a nudge, time to take your medication.
Mm-hmm.
Or if you haven't taken the medication, the system will know you have not taken the medication, right? And all that data is now connected to your pharmacy. So your pharmacy will not dispense medication if you have current medication. And so we're going to look at a society where we're starting to waste less and less, but and focused around really how do we provide a better overall patient or better user experience when it comes to managing our health.
Wow, that's really, really cool. And you see how everything's just interoperable and how everything works together in the favor of the patient. People are not being slipping through the cracks or
Yeah.
so. Yeah, I really, really hope that technology can kind of integrate that and allow people to have the best care that they can have. At the end of the day, it's going to have cost savings and it's going to have improved patient outcomes.
Yeah, we will, and I think we're getting into that place, and it's really exciting to see a lot of the new tools that are out there, and the different offerings that are available out there that really are going to contribute to some really, really amazing outcomes for patients.
Oh, absolutely. And thank you so much, Daniel. I've gotten so much insight from this interview. But the last question I want to ask you is, can you provide any advice for students and young professionals who are interested in working in the digital health space?
I get asked this question all the time, and what I always tell everyone to do is there's a book called Reframing Healthcare. And that book is written by Zeph Newworth. He's a physician out of the US. And so there's definitely obviously reference to the US model. But I think as if you're coming from a Canadian perspective, I think 90% of the book still applies. And so I would always recommend to everyone read that book first, because it'll begin to open your mind about what healthcare really should look like. Because if you're going to come into digital health, don't digitize the existing experience, right? And so, one of the things that we've done as a society is we've digitized telehealth, meaning instead of going to your doctor's office, the only thing you're doing is having a video call with your doctor's office. That's not an improvement to healthcare. It's how do you provide a customer first experience? And so take Amazon as an example, right? And draw on some of the things that Amazon experience. Amazon makes things really, really easy. Why? Because they focus on the user. They focus on that individual. And so if you're coming into to healthcare, into this digital health space, reframe healthcare, reimagine healthcare, right? And think about what are some of the places or some of the experiences that you've had, not in healthcare, that you can apply them to healthcare that creates an amazing user experience. And so, one of the things that I always say is the only place in the world, the only place in the world where you will accept and being booked a 2 o'clock appointment and being seen at 2:45 is your doctor's office.
That's true.
That's the only place in the world. You wouldn't expect that level of service from your bank. You wouldn't expect that level of service from your pharmacist, a car dealer, your real estate agent. You'd be up in arms, right? Because
meeting with your mom,
meeting with your parent,
yeah.
right? So in healthcare is the only place where they don't care about the user experience. And so if you take that Amazon experience, that Shopify experience, is make it easy. And so if you obsess about the user, that's what I'm going to tell everyone as a student, as a newbie, as an individual that's coming into this space, is come into this space with a fresh mind of reimagining, reframing how healthcare is going to be delivered by obsessing about the user. It's all about how do I create the best in-class user experience. Don't digitize an archaic system, because then you haven't really done anything. Really create a better experience for that individual.
Oh, really, really powerful advice. I really took a lot of value from that. And I will definitely link the book below, because I think I've heard of that book before and I'm going to check it out myself, but I will link the book below in the show notes.
Excellent.
Yeah. All right. Thank you so much, Daniel. And I appreciate you taking the time to give insight to our listeners. And I hope you have a wonderful day.
Thank you so much.
Thank you for listening to the Health Analytic Insights Podcast. I'd love to hear from you about topics I should cover in future episodes. Please consider subscribing and leaving a review. Have a wonderful day.